Hello. Hi, Justin.
Hey, how is everybody?
Doing good. How are you?
Doing pretty good. Busy day.
Hello.
Busy's good.
You can take
Very.
out my note taker. My note taker has not been working. It only works when it chooses to do so. I
I
actually
think
have a
I think that
phone
might be
call.
the other Lisa's or not.
Oh,
I don't know what's going on with it.
I don't know whose this is. I do a AI summary companion on all of these, but um okay.
Mine's like choosing to work when it wants, and then when I need it to come in, it doesn't work.
No, yeah. I think that was Coach Lisa's, so I'll
Oh
bring
yeah, mine mine's here.
you got a couple clients. Let's see. There's Charlotte's. And turn on the recording. Does anybody have anything pending right now before we get going client-wise? Anything urgent?
I think I just have Marthy, my client. I think you met with her a few weeks.
It's back on. All right. We got a couple. I'm going to bring them in. Hello, everybody. Have a couple people in here. Got a couple more joining. Hope everybody's having a good day. We appreciate you joining the Hormone Happy Hour today. How's everybody doing? Feel free to drop something in the chat, or you can unmute yourself. All right. Well, I wanted to start off with clients, potential clients. Does anybody have any questions or anything that we can work through with any of you?
Hi there, it's Amelia. I have a question.
Yes.
Actually, I think this question's for Charlotte, I think. I had my check-in call with Ashley last week, and I just had a quick question on parasite cleansing. Um, Last week it was a brief topic of discussion, and I asked Ashley if it's something I could consider doing since I've started all my supplementations this weekend. And I remember from last week, you mentioned we have to make sure the liver and colon are optimized before proceeding with the parasite cleanse. So I was just curious, two questions. How is that determined as far as the liver and colon being optimized? And do you have to, go through that process first, or can you trial I think you mentioned CellCore was one of the brands you recommend, just diving deep into that for a week. I just like your thoughts.
Yeah, of course. So I would definitely support the liver most of all. Quick question, when you have the protocol from Ashley, are you already doing a lot of herbs that are supposed to balance and kill off strains of pathogens or bacteria? Or are you already in that phase, or is that a
Uh,
part of your protocol or?
yeah, no, it's not part of mine. I didn't do a GI mapping, but I did do all the blood work, and all my labs were reviewed with Justin already, and we went through my supplementation protocol. Based on the liver enzymes on my lab, I was actually really surprised. They're actually really good levels. So I think the liver's optimal. I don't know about the colon though. How if that's a GI mapping is required or not. I was just curious your thoughts on just diving deep into a parasite cleansing and see how I do.
Yeah, I mean, if you're having bowel movements once or twice a day, that's always a good sign that you have good drainage pathways. I think the liver could always be supported more, especially when you're doing a lot of die-off. It always needs extra support. I think the lab testing is good for liver, but it doesn't necessarily indicate sluggishness unless you're like in a severe red flag area where your liver is really inflamed, your enzymes are really high. I mean, that's usually when it shows up on the AST and ALT, but not necessarily before that. So I would just, if you wanted to do light parasite cleansing, I recommend starting low, slow, and do small amounts on the first full moon cycle, and then you can build on that every full moon cycle. And CellCore will have, let me see if I have something here from them. They always give like this little instructional manual when you do get when you get the kit, and it shows you how to do a beginner, intermediate, and advanced. And I would probably grab Tudka, and take that like 2 weeks before, and you can take like 4 capsules for a week to help really push drainage pathways as like a gentle form of detox, and then go ahead and do your first 3 day parasite cleanse, and then go through that, see how you feel, see what you expel, or if maybe you won't say anything at all, and then start there. I think it's always good to start little by little. And as far as gut cleansing goes, if you wanted to do more advanced work before you even got into parasite cleansing to clean up that terrain, then I would suggest the Zen cleanse, mucoid plaque cleanse, as long as you don't have any pre-existing severe gut inflammation like Crohn's or um, diverticulitis or something along those lines. I'm assuming you don't, but just as a caveat, don't do that cleanse if you have that. But if you don't, you're not struggling with that, it's a green flag to go ahead and do something more advanced for your colon, even if you are pooping twice a day. It's always great to do that. Does this answer your question?
Oh, yes, definitely. Thank you.
Okay.
Can you
Yep.
repeat that? Did you say Tuca? Or can you drop the name in the
Yeah.
chat? Okay, awesome.
Yeah.
Thank you.
Perfect. Yeah.
And Charlotte, just some of the things that we're doing right now. Amelia, are you okay if I go through your supplement list so Charlotte knows? I don't think there's any interactions, but uh wanted to make sure that's okay with you.
Oh, yeah, no, not a problem.
So some guar gum fiber, some citrus bergamot, vitamin D, homocysteine supreme. She had some elevations in homocysteine, thyroid support, and then just some magnesium. So I personally, I don't know if there's any interactions. I wouldn't think so, but uh, all should be okay.
Yeah, I think all is good. Probably if you do any of like the Zen Cleanse kit, they'll ask you, unless it's a life-saving drug, or a life-saving thing, to continue to take that through the cleanse, but everything just stops the day one and day two of cleansing. For parasite cleansing, you would kind of do the same thing, only take life-saving medication if you had to, and then just stop everything else for that 3 to 7 day cycle.
Awesome. Thank you.
Thank you.
And we had a couple new names drop in. Would anybody like to ask coaching group any questions? We got everybody here. We'd be more than happy to answer anything. I see Bonnie, I see Lynn here. Feel free to use us. We are all here and available to answer your questions. Okay. Um, in regards to yes, Lisa, go ahead.
I just had a client yesterday, and it was interesting to me because she was working with a holistic hormone doctor, but wasn't really that happy. And she was put on 100 milligrams of testosterone. And then just recently, she was put on a little bit of progesterone, which was synthetic, not the bioidentical. And she's not noticing any changes, like as far as testosterone and things like that is concerned.
Doesn't sound good.
I didn't think so either. Um, so I was confused. Like, I really encouraged her. She didn't sign up or anything, but I encouraged her to jump on our Hormone Happy Hour and just ask some questions, get some more insight. But Clearly the diagnosis is off. Clearly the numbers are off. Something's askew. So I don't know. I just figured I'd put that out there and see what you had to say on that.
Yeah. I think it's really interesting. Some practitioners will give like bioidentical testosterone and then they want to give synthetic progestins or estrogens like to balance all the hormones. Really, what I've seen is like specifically progestins versus progesterone, they're going to have different actions on your progesterone receptors alpha and beta. So you may not get that same anxiolytic benefit. What that means is just like that calming effect progesterone can have. And it's such a it depends situation. Everybody here is going to react to supplements, nutrition, pharmaceuticals differently. So I really think about kind of looking at somebody's menstrual cycle if she's having that, if there is abnormalities around that. Is it cramping? Is it mood disturbances? And then we would kind of fine tune the progesterone dosing. Sometimes it may be a topical application local to the region that may be inner thighs, above or around, below the navel is a good spot to help with cramping, and that may be used days 14 through 28 days of your cycle if she's not having any mood disturbances. For someone who may have anxiety, insomnia, um, potentially the oral progesterone may be more beneficial because it's going to have more of a chance to convert into allopregnanolone and be very calming. But it is such a it depends scenario. What I see more times than not with the synthetic progestins, they don't have the same action, so they're not going to be able to help balance progesterone, estrogen metabolites, and or they may not have the same anxiolytic benefits on the brain, so it may not be as calming. The last thing is 100 milligrams of testosterone is a lot of testosterone. So, any woman here who's taking bioidentical hormones, 5, 10, 15 milligrams, somewhere in there is usually more than enough. And we have to remember that when we're using bioidenticals, they're for off-label purpose. So there's no absolutes in dosing. So someone theoretically, I guess, could take 100 milligrams. That probably would put you up to levels somewhat of like a man or a teenage boy. And we really probably want to protect femininity and not overly express androgens. So, yeah, I think as a whole, a lot of people will do hormone replacement, but there's just so much nuance. So you have the prescriber and you have that medical side, but I also think there's very much an art form to it because you have to be able to listen to patient, figure out what's going on, and then fine tune protocol. It's not an algorithm. It's not ChatGPT. You can't plug and play. It's really getting biofeedback from somebody and then fine tuning dosing. And I think that's with all hormones across the board: estradiol, testosterone, progesterone. Those things are very much based off of that client's need. I hope that answered your question. Maybe you could give her some information on that. In regards to some of the things that we have been looking at, Lisa, Coach Lisa, I had a question for you, and I won't say any names, but I'm not as familiar with this, and your verbiage it sounded like you were pretty savvy. I seen a SIBO breath test, and I'm not
Mhm.
familiar with that. I'd love you to talk a little bit more about like the methane score that you were talking about, and maybe this individual had a GI map done, and she had that test done on top of it. Um, Maybe some context on why somebody would do that. Ashley's not here. I'm not the GI person, so I'd love to hear your insight on that because I think that could be valuable for sure.
Yeah, sure. So yeah, we had a client who was showing up with some gut issues, bloating, constipation, lots of food sensitivities. And so she had gotten her GI map done. So GI map does not show It doesn't test for SIBO. So SIBO is small intestinal bacterial overgrowth. Doesn't actually test for that, but there are some markers on the GI map test that would kind of point in that direction that that someone would have the high probability of having that. That coupled with, obviously some of the biofeedback that she was experiencing. Ashley was, very in tune with that and definitely was like, let's recommend that she do a SIBO breath test. So basically it is a test where you have to like breathe into a tube. It's like about 2 to 3 hours, depending upon which test that you have. And then it tests either if it's methane dominant or hydrogen dominant. So methane dominant, the symptoms that would be for that would be like more of the constipation side. And then hydrogen dominant is more of like having more like looser stools and things like that. And so hers came back and she actually has a little bit of both, which was it was very telling. We kind of had, a feeling that she had some of those things going on as well. And now we're going to be working with a specialized protocol. I know Ashley just popped in now. So she had given her a protocol to begin with just to kind of, alleviate some of her symptoms. We were pretty sure that she had that. But now we'll have something that's very specialized to give to her.
That's interesting. And, kind of looking through, and maybe Ashley can answer this, either one of you. When we look at dysbiotic bacterias, is there certain bacterias on a GI map that would potentially point you in that direction of wanting to do that breath test? I want to know more about that. So I'm just curious if either one of you can, pick that apart a little bit for us.
Yes, absolutely. And so that's why I told her to get it, was very specifically, because there's, yeah, certain ones that tend to be higher with SIBO than others. And it's really like my thought on that is depending on how many. So like Enterococcus, Bacillus, Enterococcus, Morganella, those are the main three that I see typically with SIBO in terms of opportunistic. And then it kind of matching that with like symptoms and like, it's kind of a whole thing. I mean, you get it like looking at the map itself, depending on like how everything looks, but specifically, yeah, those are the main ones that I see specifically with that. Sometimes other ones like extrachiria sometimes, but again, depending on where it's popping up and how it's popping up.
And how would protocols as far as GI, like what difference would that breath test make in regards to treatment options for an individual?
Which, well, it depends on what's high. So like if it's methane dominant or hydrogen dominant, it depends on like which specific herbs you're using, because there's certain ones that attack against methane and certain ones against hydrogen. And so because otherwise it's really difficult to get rid of if it's not being treated appropriately, depending on what's high. And sometimes people can have both being high and extra whammy. They usually feel really good.
Yeah, I think this specific Lisa was saying that both were elevated, and I was just curious on like potentially what someone could do in regards or what would look different as far as treatments around that.
Yeah, it's just like anything else. Is a specific like SIBO protocol and specific ones that I use. Depending on where they live, like there are certain blends that are helpful, like Candibactin AR and Candibactin BR. But like neem is something really specific. Garlic is something that's really helpful. Typically, like hydrogen dominant SIBO, I typically use more like berberine with neem and oil of oregano. Methane dominant, I use more of the garlic or allicin with oil of oregano and neem. But there's a lot more with SIBO. You have to like really make sure like the motility is a really big thing with SIBO. So like really making sure that their motility is working well with that. And so how we're supporting that, supporting the liver, a detox that way. Magnesium can be really helpful. Yeah. I'm trying to think what else, like other things. Grapeseed extract can be another really good one to use. depending on like if, yeah, I mean, other things dependent. So like oregano oil is really good, but not if they're having reflux, or just being really mindful of how much, depending on that. Prokinetics are super important with like going back to that motility. So like making sure you're supporting that, because that's one of the biggest things that backs up with SIBO is the motility doesn't work properly. And so I mean, I really like Modal Pro is one of my favorites, but like Prokind is another good one. 5-HTP being high in that, ginger is high in that. I like both of those. Modal Pro's like higher, also has like a little bit of ginger in it. And then yeah, and like helping making sure their digestion's working well through that. I do like to incorporate low FODMAP for part of treatment. I think is important for SIBO. Um, but it's a little bit interesting because if they do, I don't, it can be harmful. Like if they were already doing low FODMAP, it's mostly, it's not a treatment, it's a tool. So it's a tool to make them feel better. But if they've done low FODMAP, like let's just say they figured that out or tried that to feel better, if they've been doing that for weeks, it's actually can be harder to kill SIBO because it's kind of starving them out, but not enough to like kill it. And so sometimes I might say, okay, no, actually, for this week, first week, I do want you to eat FODMAP, and then we'll, So, yeah, I don't know.
No, that's super helpful. It's a very detailed and intricate GI mapping, and it's something that I was just unfamiliar with that test, and I'm still learning quite a bit about that. So, very helpful. I appreciate that.
Yeah, and there's other things too, depending on people's what's going on. Like sometimes certain antifungals can be helpful if they have a lot of skin issues. Like there are certain things like red leaf hornopita and stuff like that that are really helpful. So or like Nutribiotics that has like coconut oil and stuff like that. So I don't know. I mean, SIBO is just insane. I also think it's really important to have binders during SIBO treatment to help pull everything out. So there's a lot to it. But it's one, I mean, usually people feel bad enough that they're like, yes, okay, give me all the things.
No, I think that's really helpful. And not to put you on the spot, but we're kind of rolling here. So I wanted to ask a couple other questions.
Yeah, yeah,
Because
go for it.
someone may watch this later and say, hey, this is me. Like, and I know every case is different, but when we have a really complex case of SIBO, and I know a couple of the coaches have went through some protocols, how long can it take to heal something like that? Maybe large extremes, like to the furthest. Like, what's the longest you see something like that take to resolve? Like worst case scenario,
Yeah.
best case scenario.
Yeah, I mean that yeah, that's a little bit of a tricky statement because only because it is so hard or it can be tricky, and so I think it has a lot to do with someone's like willingness and ability to stick with the protocol, for one. And for two, it might be another thing where they need to hit it twice. I don't know that you can always predict that, unfortunately. But I would say, and I'll be curious if Lisa has a different thought on this, I would say minimum of 3 months. And I'm not saying that they won't feel better along the way,
Sure.
but minimum of 3 months to potentially be in the clear. But there are things like with SIBO, you should be taking care of your motility for 6 months after to help prevent it not coming back, because otherwise it likes to come back. And so that's why it's like one of those, I don't know, full lifestyle, full body sort of things, meaning you need to be working on your vagus nerve and your stress techniques and on all the things on like how you're eating. Meal spacing is super important with SIBO, making sure that there are at least 4 to 5 hours between meals to help with that, motility and stuff like that. But there's so much more. I think full body, I mean, this is like full functional work here, but like addressing any structural issues like body work, if they've had surgery, if they have pelvic floor things, if they like breath work is really helpful. If there's other gut things going on too, if there's hormone things going on, it can like attach to any of that. But yeah, anyway, so 3 months minimum of of treatment, but that's not even like repair phase after. So if we're looking at repair phase two, I would say 6 months really minimum if you're looking at follow that. But I mean, maybe even a year if you really think about doing, we want to like resolve the motility and make sure we're keeping with motility and to keep things flowing, because if things start to back up again, it can come back.
Awesome. And last thing, because the before and after of working on that, Lisa, was very pronounced in regards to what you were able to do in that short period of time. Was this individual able to have some symptom relief? Because looking at it, like the amount of reduction in bloating in her waistline, I mean, it was like um, night and day, it's pretty amazing. So like how long was that? And then did she have like some symptom relief around that?
So let's see, I know who you're talking about.
Yeah.
She started a few months ago. So, and she's been very diligent with her diet, but and she's super transparent too when she's like, oh, I've been eating the things and, doing whatever and just kind of been a little bit off. But that was the picture that she sent before was before she started the program. And so the picture that she sent recently was just like, I don't know, maybe like 2 months in. And that was just from like us just working together and just being mindful, like, hey, these are some of your triggers. So some of her triggers were definitely gluten and dairy. And she knew it. She knew like she would come back from a party and she was like, oh, I ate even like a small piece of cake and I'm regretting it and whatever. And we were just talking about just trying to be really, kind to yourself too, because, eliminating these things out of your diet, it can be really hard. You have events and things coming up, but just being really mindful and tuning into like what is, what's upsetting me right now? What is it causing? That can be just like it's very empowering to know that and then to kind of take it out. And I always like to say to a lot of clients, it's not forever. This is just for a period of time. Like our dream is for you to be eating and digesting all the foods. Sure, there are some foods that, may not, we love them, but they might not love us back. They might not be good fits for us. But at the end of the day, there's so many options out there that we can find, and it really is a nice experience to kind of go through and be like, okay, you know what? I can't eat these things anymore, but what can I eat? There is a world out there besides, some of the things that are upsetting us. And, it is a form of self-love to kind of figure out like, okay, these foods don't agree with me. What else can I, implement in there? So, we've been working together. She's, a great client in that, again, she's super transparent when something's wrong and, reaching out when she's having issues and SIBO protocol is not for the faint of heart. They are really they can be really challenging. They can really test you. I've had, wow, I don't even know how many clients go through. Probably I could count them more than on both hands. Probably like 15 or 20-ish clients that have gone through SIBO or Candida or, just really rough protocols. I myself also went through one. It's 3 years ago. 3 years ago, around this time of year, I went through one myself and it was hard. It was through summertime when, I mean, there's parties and barbecues and beach outings and stuff like that. And it was a really rough experience. But I have to say, like, it's almost like an upkeep of a car though, like it's gone away and whatever, but I know that I'll always I have Hashimoto's, which, is linked up to leaky gut and all those other kinds of things. So it's definitely an upkeep for me. Like I always have to kind of check myself and, some of these things flare up again, but, there is hope on the other side. I mean, I struggled with all the things, constipation. I was on every reflux medication you could ever know, every PPI. And I struggled with, low stomach acid, like to the point where like, I would go to sleep at night and I would feel like the reflux was just constant. And, it took a long time to put those pieces together to feel like, okay, it's constipation, it's a lot of bloating, a lot of like gut sensitivities, a lot of reflux, like all these things. But actually when I did it, I never did a SIBO breath test. I never even did a GI map. The practitioner I was with was just like, you just have all the signs. Let's just do a protocol. And we went through it. And it was very, very similar to what Ashley explained. Like we rotated all the things, the oregano oil, I did caprylic acid, grapefruit extract, I'm trying to think of all the other ones. All,
And
yeah,
rotation's really important. I'll just throw that out there. Sorry to interrupt. Like, because
100%.
if you're not rotating them, then your body can basically build up a like response against that too. So that's really important, specifically with SIBO, is making sure. Another one that I didn't mention that I use a lot is like red yeast rice. I use a lot too for methane. But yeah, anyway, sorry I didn't mean to interrupt. I was just thinking
No,
about it because you
no.
were like, oh, I'm naming off these things.
100%. Yeah. Yeah. It's almost like antibiotics. Like when you think about it, your doctor's always like, did you take this before? Because you build up an immunity to it. And those little buggers in there, they're so smart. They're hiding. You might do a biofilm disruptor. So biofilms are, kind of like the mucus and, all the bad stuff and the gunk in our intestines. And so sometimes that stuff, that's where those bad,
They hide.
they hiding in there. So the biofilm disruptor, I felt like, I know when I did it the first time, it was just like, wow, like it was such a difference. You might feel like brain clarity, like I had a lot of brain fog and things like that going on too. So, it's very true. When you are constipated and a lot of toxic buildup, it really brings you down. There's a lightness that you feel when you start to, kind of eliminate all those toxins. So, I mean, I just anytime I put someone through one of these protocols, I'm just like, there is hope on the other side because
Yeah.
and it's nice when you finally heal that gut, it's amazing. It's amazing.
But it's also a process because, there can be die-off symptoms. And so sometimes people feel, I don't necessarily want to say worse before they're better, but maybe a little worse before they're better. And so sometimes that can be discouraging for people to stick with it. And that's that, like, you hang tough because there can be the die-off symptoms. I know when I like first really studied this and started learning about it, I had a practitioner telling me like, it's like not too easy, not too hard. Like treatment should not be super easy. If it's super easy, then you're not doing enough. And if it's way too hard that you can't do it, then it may be too much. So sometimes you have to kind of dial in how much it is. It should be a little hard. It shouldn't be like you can't leave your house because you're in the bathroom. But it also shouldn't initially feel easy, unfortunately. Otherwise, it's not killing it off quite as well as it needs to be.
Think that's great perspective, Lisa, and then Ashley. I appreciate the additional insight on that. I guess last question, Lisa, if you don't mind. Uh, in regards to you doing all this GI stuff and your Hashimoto's, were you the one to put that together, or did you have a practitioner good enough to help you kind of figure out all of those things were interconnected? Because what I see with a lot of women coming in here is like, no, it's an isolated issue, and my doctor says this is another isolated issue. And well, the way I think about the body and health is it's normally never an isolated issue. It's like multifactorial kind of bleeding in. So I always think it's great to hear from the coaches because all of you have your own, story on healing or working towards health and what that looked like for you.
Yeah, wow, it was like it was kind of all over the place. It was very messy. It wasn't like just kind of like a one stop shop type of thing. I mean, I saw a functional practitioner. I don't remember. I think it was like right after lockdown, like in 2020, because I had like all sorts of, I didn't have COVID at that time, but I had all sorts of weird symptoms. And I didn't know what was going on with my body, but I knew I had Hashimoto's. I knew it was like probably flaring up. And we worked on a lot of like, I have Epstein-Barr virus. And so we worked on a lot of like, just healing of that, just like immuno system. Like, we didn't really work on the gut. We didn't really I don't want to say we really didn't get to that, but she was working on thyroid and like immune system at that point. And then fast forward 2022 when I did the SIBO, it was just like it was that those issues were just always there. Just the constipation, just like I don't know, I just felt like that was just my normal, I was just like, I'm just always gonna have these gut issues. I just didn't know. And so then working with that practitioner, that's when I kind of learned. And then that's when I was going through my own, education as a coach too. So I felt like it was kind of like really synergistic, where it was just like, okay, I'm working with a practitioner and we're doing this SIBO protocol, and then I'm also learning about it. And so it was like then I was applying it to my clients as well. So it was kind of, I don't know, serendipitous in some sort of ways too, because it was like, you learn so much when you go through something yourself, and then when you see others go through it. Of course, our journeys are always very different. It's not the same healing path, but it's nice to speak from experience. So yeah, it wasn't like it was all over the place. And then again, like taking what I had learned from, understanding autoimmune and thyroid and gut and all of that kind of stuff has been, it's pretty eye-opening, because it's like, it's not exactly what you said, Justin. It's not just like compartmentalized. Your body is not just like, this isn't functioning and we got to do this. It's almost like you need to kind of work on all the systems. Sometimes not all at once. Sometimes it needs to be phased, but a lot of times there's a lot of interconnectedness going on. So yeah, it was a little bit of everything, working with a practitioner, my own education, and yeah, a lot of, it did take a long time. Exactly what Ashley said. I think for me, it was 2 rounds. It took a long time. Like I want to say it was like 6 months for me. So I don't say that to discourage anybody. And I've actually talked to one of my clients today. I was like, it might get a little bit worse before it gets better, because I just wanted to give her that um just piece of advice. Like I don't want to sugarcoat it, but I don't want to tell her it's going to be hell, but just like keep close to us and let us know how you feel, because any protocol can be kind of tailor fit. I've worked with so many different clients where we're like, okay, that oregano oil is too much, is like really upsetting my stomach and whatever. Let's back off of that. Oh, let's try a different supplement. So there's always more routes to success. There's not always just one path to success. So, be anybody that's going through any of those types of protocols, you just keep close to us coaches, and we could always tailor fit it for you.
Well, that's great. I appreciate that. I think this will just be our hormone or our GI happy hour today. Uh, I had one last question, and then I'll quit peppering you all with questions. I was speaking with a client last week, high stress, um, business owner, always going, eating and working and eating and talking. And we were talking about, kind of basic principles of like digestion and how much our nervous system can influence the way we like are able to process food and digest them. Is there any like core principles that you recommend around eat, like when you're going to eat? Is there certain things that you like to do yourself or recommend clients to do? Just like maybe blanket statement that all of us should probably be doing so we're able to digest our food.
I always say people don't, Ashley could probably answer this too, but like chew your food to the point of like, it should, and not to sound gross or whatever, but it should be like liquid almost, because otherwise then like if you're not chewing your food, then your stomach's doing the breaking down for you. And a lot of times that's where we have bloating and whatnot. But yeah, maybe not having a phone while you're eating lunch or having dinner, just being really focused and being present, slowing down. I mean, myself included, that was a hard lesson for me to learn, because I was always a very go, go, go person when I worked in corporate. And not even that, just even after I left corporate, even now, like I still have to tell myself to slow down. And then sometimes not drinking, well, I don't know how anybody else feels about it, but not drinking so much water with the meal, because it can kind of like dilute your gastric juices. I do feel like sometimes that topic is a little bit debatable, but I don't know, Ashley, how you feel about that, but I do think that sometimes it's like, let's get the food going in instead of just the food and the water and all of that stuff.
Yeah, I mean, I have several thoughts. I also feel like especially today, there's lots of GI today. I'm like, y'all don't know. I've said this like 6 times today already. No, I'm just kidding. No, it is funny when you say things a lot that it's like, I feel like this is common knowledge now. No, I mean, actually very strong thoughts on what I think everybody should be doing. And well, I mean, one for sure, but one of chewing your food for sure. And actually, there's a research that I think I did in some I don't know, I recorded something, one of those, I don't know what I would call it, a seminar, whatever I did, whatever those are called, mentorship thing that I talked about. I did some research one on what a proper chew is, and a proper chew is like 37 chews. And I
Oh,
can probably guarantee that no one on here like chews one bite of steak 37 times before they
no.
swallow. Nor probably will I. However, it was pretty eye-opening to think about like that being a proper chew. But no, one of the things I tell people a lot, especially when they're having GI stuff, but in general, everyone should do. Yeah, sit down to eat for sure. I know that's hard for especially all of us coming and going, but sit down to eat. Look at your food and smell your food before you eat it. When you look at your food and you smell your food, it releases gastric secretions that help break up your food. If you are watching TV or working while eating, sometimes you do not release those secretions and you are not breaking up the food as well as you could. Even in the stomach, it doesn't break it up as well. You're not quite getting that breakdown. And actually, not if anyone's interested, that actually supposedly in the dietitian world, people correlate that back to praying over food and how and or like thanking the chef and stuff like that. That all of that is like proper to help prep the body for food. So like really appreciating where the food came from or whatever, that goes down like a, obviously maybe a hokey path for some people, but so yeah, another thing that honestly I think everyone should do that I don't do this great either, but even breathing before you eat. People with reflux, and let's just say it's not associated with H. pylori or something. Let's just say whatever, they have reflux. There are studies that say that 1 minute of deep breathing before meals, if you are consistent with it for 6 months, can get rid of reflux. There's a lot of like actually biological things about that, and helping prep your body for food as well. Yeah, so those are kind of the big ones. And also, yeah, bulk of your liquids should be outside of meals. That does not mean you can't sip some water to swallow the steak sort of thing. But bulk of your liquids should be outside of the meals so that your body does use those secretions to help break up the food. So yeah, those would be my tidbits.
I really like the breathing piece because I think probably some of us here on this call and me right now, when I'm working, sometimes I can be very short with my breath and that carries over. So you saying that just had me take a second and take a deep breath and I feel 2% better. So I appreciate that.
I was talking with clients, I don't know, a couple of days, and I happened to be working out of a friend's house. And I was telling somebody, yeah, like, take a breath before you eat. And anyway, I like apologized to a friend. I was like, sorry, you could hear me. And she was like, it made me take a breath. I was like, that's great. Like, but in general, I think a lot of us, we're going so fast that we tend to be shallow breathers, in general. And actually there's a lot of just functionality of not only our digestion, but even like all of our blood work and like organs working properly. If we can get full breaths and like pelvic floors and all of those things, like full breaths are actually really important in oxygenating our blood properly and all that.
Yeah, super helpful. I think the big things that I took away from both of you is, you know, taking a second to be still and eating your food. I think that's probably a really big piece of it. And I'm very guilty of that. And you helped me with some GI stuff a year ago. But, I think the majority of us can blow and go or eat in the car or eat on a meeting. So I really think about like some of those principles being important because, of course, the GI mapping and supplements and all those things are helpful. But I really think about like root foundations probably being things that a lot of people don't talk about. And I feel like now in the world of like marketing and social media, everybody's got a supplement or like some fancy test they want to do on you. And those things are helpful, but we also really want to kind of look at like baseline processes. I'm always gonna, harp on those because I think without those, fancy supplements and testings and protocols, those things are less effective or maybe not effective if we're not able to do the baseline things and kind of be in tune with our bodies.
It's tricky. I talked to somebody earlier today, and poor thing, she's been dealing with gut issues for years and years and years, and she has seen specialist after specialist after specialist, and seen all these GI doctors, and had all sorts of scopes and colonoscopies and whatever, and I don't know, it was like very, very, very cool to be like, I know why you're having problems. And she said, I'm going to pray for you my whole life if you can fix me. Yes, I'll take it.
I think that
But
was it my client?
it was,
I think
yeah,
so.
it
Yeah.
was,
Yeah.
yeah. She was great, but anyway, I thought of that just because they're, and not to knock, the clinical world, but in general, they're, yeah, and obviously going to give her treatment for what's going on, but there is so much, I thought about it too, just in talking about, because when I was talking about breathing and slowing down and looking at her food, she's like, oh, I don't do that. And so I just think that, like Lisa said, it is so interconnected, or you both have said it. I mean, there's so much to, I'll say, disease, right? That we can heal so much from the basics, from sunlight, from sleep, from breathing, from stress relief. Like, our bodies are powerful if we give them half a chance. And sure, let's also support it with some herbs and figuring out exactly what's going on, so we know like which herbs we need or whatever. But it's just, there's so much truth to how much some of the simple things we take for granted, and exercising and sleep and sunlight and breathing, that can be great healers in themselves.
Absolutely. Yeah, I appreciate that. I'll give you a chance to catch your breath because I've had you talking for 20 minutes. Do any clients here have any specific questions for Lisa or Ashley while we're here talking about GI? Um, if not, I kind of wanted to segue into nervous system and potentially how that impacts GI. I think that's an interesting piece that a lot of people don't talk about, but I wanted to give clients a moment if anything came to mind. Okay. Ashley, I hope you caught your breath. I want to ask you another question. Um, Talk about intrinsic nervous system and potentially like how that's interconnected with you know PNS and how we need to be in that calm state for motility and digestive function. And I just think it's super interesting. I don't see a lot of people talking about that.
Yeah, absolutely. Well, I'll say it from several different ways, and it is so true. So, like, our autonomic nervous system, it voluntarily regulates things in the gut, right? Like, and our parasympathetic nervous system is actually called rest and digest. Like, that's another form that we use, especially in the dietitian world. That parasympathetic nervous system is actually what really is like a huge piece of digestion. Which I'll bounce around a little bit just because that's how my brain works. But it's why sleep is also so, so, so important, because our body needs that rest and digest time to really, and repair and all of that. But that parasympathetic nervous system, it helps with the motility, so things flowing properly, both fast and slow, right? Like a proper flow of that. It influences how, like I talked about before, like secretions, like enzyme secretions, and like our blood flow. So, I mean, just in terms of layman's terms, you think about, let's just think about stress, right? How stress impacts our blood pressure and our blood volume and whatever, and vice versa, how meditation or deep breathing can slow that down. And you can physically take yourself out of fight or flight just by doing like certain breathe holds, right? Just because it tells your body it's okay to rest. And I make the analogy a lot, just because I think it's, I don't know, monkey minds or whatever. It's easiest for us to understand. Like, you think caveman times of like, our body needs the ability to run from a saber-toothed tiger, right? So it's going to pour glucose on our blood, and our cortisol is going to go up, and we need to be able to run. And it slows down your digestion, because nobody needs to pee when they're running from a saber-toothed tiger. But unfortunately, this day and age, like, we're not even, usually the things that are raising our blood pressure and slowing down our digestion aren't usually a saber-toothed tiger and aren't life or death, yet our internal body has the same exact response. It's slowing down our digestion, it's raising our blood pressure, it's increasing all this inflammation, which classically was used to save our lives. But right now it's like work stress, right? Like it's like, whatever, relationship stress or whatever, that we're not actually about to die, even though we feel like that. And so vice versa, we have such an ability to slow down that process. So that fight or flight is our sympathetic nervous system, right? Our sympathetic nervous system is what actually slows our digestion, because like I said, don't need to pee if you're running from a saber-toothed tiger. It constricts our blood vessels and messes with our secretion. So when we can move into that rest and digest, that's when the motility works well and our blood flow works well and whatever. And so that's why a lot of times you have somebody who is stressed, they have sluggish digestion, they're having gas and bloating, they're, getting leaky gut and all of those things. And it's really because we're thinking we're running from a saber-toothed tiger. And so one of the things that I think is just fascinating and so simple is that if you are working in this chronic stress, if you can take time to regularly do some deep breathing. I really personally love a 4-7-8 breathe hold for people who are chronically stressed. And if you don't know what it is, it's like breathe in for 4 seconds, you hold for 7, and then release for 8. If you are exhaling longer than an inhale, it tells your body you're okay. Hey, there's not actually a tiger. You're okay. And so it does start to increase the digestion and regulate your blood flow and all of that. And then you get to start to communicate. The brain via the vagus nerve starts to communicate with your gut motility and your enzyme and mucus production and like gut barrier signaling and all of that. And so, yeah, anyway, I think it's fascinating, but it's also cool. It is so simple in theory for us to breathe or meditate. But I don't know if anybody saw my post today, but like that, how it all feels really hard, but maybe the alternative to not feeling good is harder, or the bathroom issues are harder. Can we take 5 minutes to like breathe or meditate or whatever? I just think they can be very powerful. It also can like super influence like your neurotransmitters and how like, so like GABA and serotonin and dopamine or whatever, because that when your gut is functioning properly and getting good blood flow and that in fight or flight, like that, those gut microbes actually produce those neurotransmitters. And your gut, oh my God, I could just talk for hours on this stuff, but like our gut is like the second brain, right? And so it like that balance of our gut based, even just sheerly based off of stress, impacts our brain and how, and whether we're sleeping well and, yeah. So, yeah.
Thank you. No, that was awesome. I think that we packed a ton of information on that. I have the transcriber going, so I'll share this information with Davey. And yeah, really, we spent so much time on GI stuff. I think that there's like really good nuggets in here. So if someone wants to sit and learn coming in, this would be a great one to watch. So I appreciate you sharing so much information. If I don't have any other questions, we will wrap up. We have about 5 minutes, so I wanted to pause just for a second, see if I have any other takers. Lisa, I see you have to go. Thank you so much for your input. If not, we will wrap up, but I'm gonna give it 15, 20 seconds, see if anybody has anything.
I have one question.
Absolutely.
It's actually not gut related. The latest hot topic out there, I'm gonna say it out on Instagram, is perimenopausal, menopausal women and creatine, not creatinine. Creatine. What's your thoughts, Justin, on taking creatine?
It is almost like a multivitamin. There's different types of creatine. Creatine monohydrate can be harder for some people to digest. I can't remember the type of creatine that's a little bit easier on the gut. I would go low and slow. 2 milligrams upwards to 5 milligrams. Sleep deprivation studies show 20 milligrams of I'm sorry, 20 grams of creatine has beneficial with neurological function. I really like it. I think the big things that we think about with creatine is just making sure we're hydrated if we're going to use it. But I think of supporting homocysteine and methylation. We look at the cognitive improvements with it, obviously muscle mass and performance in the gym. But I think you could have issues with it if you have a sensitive stomach. Some forms of creatine are a little bit easier on the stomach. But I would say that most people probably could take it and not have much issues. I use 5 to 10 grams of creatine every day. I would be interested on the ladies, the coaches, what their thoughts are on it.
I can say from anybody that's taking creatine, from the people that I work with, just based off of feedback from real results, women love it. They feel better, they feel stronger. Some do report gut irritation, like mild bloating, or like, oh, I felt a little funny, but I feel stronger, or my brain fog got a little less. So that's just anecdotal evidence on my side from people taking it.
I've probably had more, and actually, I told her this the other day. I have had more people with gut things or just water retention with it. With women, I've never had a, I don't know. I mean, maybe a gut, maybe once with a male. I feel like a lot of males have really enjoyed it. I've probably had maybe 50-50 or maybe more have more issues with water retention and bloating with it than not.
I had sent this. Someone was asking me about it yesterday, and I actually looked at the two different um, creatine hydrochloride. So HCl apparently is easier on the stomach. Uh, Halima, I seen that you posted in here brand. Thorne makes the creatine hydrochloride. You can get creatine monohydrate anywhere. It's dirt cheap. I mean, you can get 100 servings for like $10. I would start low and slow though. I think typical dosings like five, maybe start with like half of that and just kind of based off of response. The water retention, the GI issues, they can, show up for some people. Uh, I would say I agree with Ashley. I see a lot more women tend to have digestive issues with it. I think us men, we're just not in tune with our bodies, so you can give us anything and we'll say we're okay. But I absolutely see it with females for sure.
Thank you. Appreciate it.
Absolutely. Yes. All right, everybody. This was a great call. I want to thank the coaches so much for all their input here, and I will send this info over so we'll have a recap out. Hope everybody has a great day. Bye.